Cathy Proudfoot is one person keeping a close eye on social services development in Wales. She looks after her two severely autistic children with her husband Ian, who's a wheelchair user. She welcomes any changes that make dealing with social services easier.
With us, we wanted our children to have a particular service, and they were offering existing services they already had, which our children didn't fit into. So it's often like the square peg round hole situation. So I think anything that makes it more people-centred has got to be a good thing.
Cathy's husband Ian says they've struggled in the past to find the right services for their family.
Our experience with the children, they don't fit into any of the specific criteria, so it was very, very difficult and quite frustrating from our point of view to try and be creative, whereas the social services were resistant to looking at the children as individuals and meeting their needs, rather than obviously the service meeting the needs of the children.
Of course, it's not just carers and children that might benefit from these proposals, but older people too.
As important, if not more important than just talking to local government, is to make sure that the Assembly is talking to the wider partnership, that they are talking to local government and health. They're not just talking to social services, even though we're talking about social care. They're talking to people who work in housing, talking to people who work in education and planning, in leisure, but also people in the voluntary sector, and most importantly, from the Commission's perspective, older people themselves. There is nowhere better than to get feedback and honest opinions about services, about what's good and about what needs to change, than from the people who are using the services themselves. So that's where older people's experiences really need to be sought out and listened to very carefully.
The government's white paper says local authorities need to work together to deliver better services.
We can't wait for the 5 years, of course. We've got to start this afternoon, and we can't buy a way out of this one. Within the time available to us now, we will seek to build a consensus. We will listen to what people have to say to us, and we will look forward to local governments and the private sector, for example, bringing forward their plans to achieve this.
For their part, local authorities say they too want to work with the government to see improvements in social care.